It starts with normal slips such as misplacing keys or a wallet until finally a family name is forgotten. This is the reality of Alzheimer's disease, which affects an estimated 450,000 Canadians and their families. The disease attacks memory and the ability to do normal everyday activities and takes a large toll on the patient and caregivers. Medications to treat the symptoms have been available, but they can be difficult for some patients to take and can cause side effects such as nausea, resulting in half of Alzheimer's disease patients stopping treatment after just a few months.
Alzheimer's disease should be perceived as a family disease. It involves the whole family, the patient, the caregiver, and any family members that come in contact with the patient. They have to learn to live with the disease as well as the caregiver does.
Now there is a novel approach to treat Alzheimer's disease. Health Canada has recently approved Exelon Patch, the first and only skin patch for the treatment of mild to moderate Alzheimer's. This patch results in consistent delivery of the medication and fewer side effects. It's easy to use, no pills to swallow or to remember. Dr. Sandra Black specializes in the treatment of Alzheimer's disease in Toronto.
So the idea of having a patch is attractive because it allows a smoother uptake of the medication, and it often can be used once a day. So this would be a big advantage for caregivers and for patients because it makes the drug easier to use. And it also happens to be the case that it's better tolerated. So in the case of Exelon, which is the drug that's going to be in this new patch, patients can now take it once a day as opposed to twice a day, and it has a much better side effect profile.
Exelon Patch is applied easily to the back, chest, or upper arm and provides smooth and continuous delivery of medication through the skin over 24 hours. Scott Dudgeon, CEO of the Alzheimer's Society of Canada, says new treatment options will help to better manage the disease for patients.
People are going to respond differently to different medications, so it's very important that clinicians and the people that are being treated have access to new and innovative ways of dealing with the disease.
The patch was designed with compliance in mind. According to an international study, the patch was preferred to capsules as a method of drug delivery by more than 70% of Alzheimer's caregivers. This treatment provides caregivers visual reassurance that the medication has been administered, reducing some of the burden associated with caring for a loved one affected by Alzheimer's disease.
The use of a transdermal patch would simplify treatment with my husband in that he occasionally forgets his pills.
Like I did last night.
Yes.
By 2030, the number of Canadians with Alzheimer's disease is expected to rise to 750,000. It's estimated that 35% of Canadians aged 85 or older have or will get Alzheimer's disease. For more information about Alzheimer's disease or treatment options, speak with your doctor. Brian Wicks reporting.